So when Lisa Parker and I first sat down talking about let's finally do the symposium that we've been thinking about for a while, and we thought about who we wanted to invite, and she very much gave me carte blanche to invite the folks who I wanted. One of the very first names that came to my mind was Dr. Beth McGinty. I remember, folks who know me know I'm kind of a research nerd. I like my articles and my books, and I can remember vividly when I read one of her articles in the American Journal of Psychiatry about the media coverage in the wake of the Newtown, Connecticut, the Sandy Hook tragedy, and the content of the media and the impact of that media coverage and the distortions and the conflations around psychiatric illnesses and violence risk and just sort of the repercussions and impact of them. And it was very powerful for me to read that, especially as a practicing psychiatrist who works in some of these issues. And just, as a person going through life, we see the impact of some of this media stigma in surprising and unexpected ways. She's part of the Bloomberg School of Public Health at Johns Hopkins and part of the core faculty of the Hopkins Center for Gun Policy and Research. She has a background in epidemiology and public health that has a fairly unique intersection looking at mental health and policy as well as gun violence and stigma. I'm very excited to introduce to you Dr. Beth McGinty.
Thank you so much to Jack and Lisa for organizing this great event and including me, and thank you all for taking your day to be here. I've really enjoyed and learned a lot from the presentations so far, and I think that I'm sort of coming full circle from Dr. Mulvey's original presentation around mental illness and violence. So I'm going to focus here on news media coverage of mental illness and violence, and specifically what we know empirically in how the news media covers gun violence, specifically with a focus on mass shootings, given our topic here today. And then I'm also going to talk about what we know from a research perspective about how that news media coverage influences public attitudes. With a specific interest, I often look at attitudes in two buckets, one being stigmatizing attitudes. How does news media coverage influence public stigma toward, in this case, people with mental illness? And on the other hand, policy attitudes. How does news media coverage of mental illness and gun violence influence support for firearm policies or support for mental health policies? So that's the general outline of what I'm going to do here today. So we have extensive nationwide news media coverage of mass shootings. The cover of Time and Newsweek following two major mass shootings about 5 or 6 years ago now. And in much of that news coverage, as you can see sort of just implied from the images used on these covers, has really focused on either a documented or sometimes purported but not documented role of serious mental illness in these mass shooting events. That news media attention, of course, draws public attention to these events and creates a window of opportunity for policy change, right, in the political cycle. Firearm policy in particular, very politicized, very controversial, very hard to get any sort of movement, particularly in the direction of strengthening firearm laws or further restricting access to firearms in the US. But mass shootings sometimes, not always, open up a window of opportunity in which there is serious debate and sometimes some actual policy enactment, particularly at the state level. We've not seen much at the federal level following these mass shootings. We also see lots of proposals following mass shootings about improving the public mental health system, which for someone like me who's a mental health policy researcher creates a bit of a conundrum in that the public mental health system needs a lot of improvement, and improving it would help many people. But as you heard from Dr. Mulvey, improving that mental health system is not going to prevent gun violence in the United States, or it's only going to prevent a very small portion of gun violence in the United States. So I'm going to give a very brief, Dr. Mulvey largely did it for me, a largely brief summary of the evidence on the relationship between mental illness and violence. And my goal with that is not to be repetitive, but simply to reframe some of the key concepts so that we can then make a comparison between what the epidemiologic evidence says about the relationship between mental illness and violence and how the news media portrays that relationship, right? So think about it in terms of that context when I run through those 3 or 4 slides. Then I'll tell you about what we found in studies of news media coverage of mental illness and violence, and then talk, as I alluded to before, about implications for public attitudes. And I'll have a few conclusions at the end, but I'll sort of ruin those now and tell you that my conclusions are mostly questions for the group. So mental illness is very common. About 1 in 4 people in the US have a mental illness. 1 in 17 adults has what I'm using the term serious mental illness to mean, which technically means any mental illness that causes significant impairment, prevents you from doing daily activities of living, but is usually in the literature a term that's used to refer to psychotic conditions like schizophrenia and bipolar disorder. So when you hear me use that term, serious mental illness, that's what I mean. And the majority of US adults with mental illness do not get adequate treatment. So untreated mental illness in the US is a critical public health problem. In 2016, which is the most recent year of data available, we had almost 40,000 gun deaths in the United States. And the majority of those, about 60%, were suicide. Which I know surprised me when I first started working on this topic because homicide gets a lot more attention in the policy dialogue, but actually most of our firearm deaths are suicide. We had a little over 14,400 firearm homicides in the US, and that other bucket is accidental shootings and things like law enforcement officer involved shootings. So I just gave you 30,000-foot epidemiology of mental illness, 30,000-foot epidemiology of gun violence. So how do these things overlap? So as you heard from Dr. Mulvey, when we think about interpersonal violence, violence directed at other people, there's actually not a great deal of causal overlap. Only about 4% of interpersonal violence is directly attributable to mental illness. And I want to give credit to this slide and the following slide to my friend and colleague, Jeff Swanson at Duke, who's really been a pioneer working in this area. And we present together a lot through our work on the Consortium for Risk-Based Firearm Policy, and we present often on similar topics separately. And I had sort of created my own version of these slides, which were not nearly as pretty, and Jeff was at some point like, Beth, just use my slides, they're much better. So here you go with Jeff's slides. All right. So that said, while I just showed you that at the population level, most interpersonal violence not caused by mental illness, we do know, again, just reiterating what you heard this morning, that at certain times and in certain settings, people with mental illness are at elevated risk of violence, right? So these are prevalence numbers, just people who exhibited violence behavior towards others. And you see that in particular, we have elevated prevalence of interpersonal violence among people who are involuntarily committed to psychiatric care, which makes sense, given that one of the criteria for involuntary commitment is a finding of dangerousness to self or others. And we see elevated risk of interpersonal violence prevalence, not risk, among people experiencing a first episode of psychosis, which I think, again, makes intuitive sense because by definition, it's your first episode of psychosis, it's untreated, most likely. All right, so often when I sort of spew out that line of reasoning, the question that I get is, but isn't anybody who hurts someone else mentally ill, right? Isn't anybody who commits a homicide or any kind of act of violence directed at another person, don't they by definition have a mental illness? And this is something that I struggle to answer because that's such an intuitive line of thinking, right? So the way that I think about this as a researcher and the way that I've talked to a lot of clinicians about this, the clinicians in the room can weigh in if they want to, is that we need to make a distinction between mental illness and mental wellness. And I would argue that, anybody who hurts another person is probably not mentally well. There are probably some anger issues, right? Some antisocial issues, some impulsivity issues. Are those mental illnesses? Maybe, depending on the definition, if you're thinking about personality disorders as mental illnesses. They are not anxiety, depression, schizophrenia, bipolar disorder, the sort of most common conditions that we think of as mental illnesses, and they are not treatable in the same concrete way of there is a medication, there is an accepted line of therapy, although there are some treatment courses for personality disorders, don't get me wrong. So that's one important distinction. The other important distinction is one that you heard alluded to this morning, is we need to realize that mental illness is not the strongest of the many risk factors for interpersonal violence, right? What we are often dealing with is an ingrained history of violent behavior that builds and builds and builds. Substance misuse, particularly alcohol. Alcohol is the big culprit in terms of interpersonal violence, a much, much stronger risk factor. History of trauma and abuse, socioeconomic risk factors like poverty, situational risk factors like life stressors around work and family. All of these things are stronger risk factors for interpersonal violence than mental illness. And often all of these things are happening all at once, right? Potentially along with some depression or some anxiety. They're all sort of all together. You don't have one by itself, generally. Okay. Now, a word about suicide, right? And I should just flag in terms of my language. I've been trying to be purposeful and use the term interpersonal violence, right? Violence toward others, because suicide is also violence. For the sake of shorthand and saving words, moving forward, when I say violence, I mean interpersonal violence. I will say suicide if I mean suicide, okay? So as I said a few slides ago, the majority of firearm fatalities in the US are suicides. And about half of deaths from suicide involves guns, right? Suicides are by far the most, firearms are the most lethal means of suicide in the United States. And so the relationship between mental illness and violence that I just explained in terms of interpersonal violence is quite different for suicide. The exact number varies depending upon the study and a bunch of wonky meta-analytic details that I will not bore you with, but the equivalent, the parallel number to that 4% attributable risk of mental illness with interpersonal violence for suicide is much higher. It's between 50 and 75. So there is a strong and direct link, particularly between depression and suicide, but other conditions as well. All right, and so again, as Dr. Mulvey alluded to this morning, there is a gap between everything I just told you and what the public thinks, right? So in one survey that we did, we found that about 46%, almost half of Americans, it was a nationally representative sample, thought that people with, quote, serious mental illness were much more likely to be dangerous than others. If you ask that question about schizophrenia or use the word psychosis in the question, it's much higher. Between 60 and 70% will say yes, usually. All right, so one of the questions that has motivated my work in this area is, why the gap? Right? I'm a public health person. I see the epidemiology. It is complicated epidemiology in this case. But why is there this gap between what the evidence shows us and what the public thinks? And does the news media potentially play a role? So my line of research in this area has really been all around that general question, and that's what I will dive into now. So we conducted a relatively recent study to look at this question in one of the most general ways possible, which was just to say, in all of the news media coverage that's out there about mental illness, any news story about mental illness related to anything at all, what are the specific topics that are being covered? And is violence one of those topics? And how much of the news media coverage about mental illness is focused on violence? And so what we found was that the answer to that question was quite a lot of it, right? So in this study, and I'll just say a brief word about how we do these studies, so you have a general sense of what I'm talking about. But so we will pull a large random sample of news stories about a given topic from a sample frame that we try to make as national as possible. So we'll often sample for example, like the 5 or 10 highest circulation national newspapers, and maybe 1 or 2 of the highest circulation newspapers within each census region. The 3 major television networks we always include, and we usually include CNN and Fox as well. Sometimes we include internet news, sometimes not. There are tricky research reasons that make that challenging. So this included 14 news sources that met that general sample frame that we used. A key gap in what I just described is that there's no local news in there. And that is purely for research reasons. It's not in LexisNexis, right, which is the database that we use to identify these news sources. So there are some ways around that, but this study and the next study I'm going to describe did not include local news, which is an important gap because a lot of Americans get their news from local news. Okay? So in this study, we looked at 20 years worth of news media coverage of mental illness. And we found that over half, 55% of the news stories that we sampled over that period focused on violence. Right? About 38% of news stories about mental illness tied together mental illness and interpersonal violence. So a story about a mass shooter that's talking about the role of serious mental illness in that shooting would have fallen into that category. 29% talked about suicide related to mental illness. And then, of course, there were some stories that discussed both. So that's why those numbers don't add up perfectly. In contrast, only 14% of news stories talked about successful treatment for and recovery from mental illness. And just a note, although this is not what I'm going to focus on moving forward, that similar findings have also been found for entertainment media. So, we're the group that's really doing this study now, but Otto Wall's group was the pioneer in this and did similar studies in the 80s and 90s and found essentially the same thing. That a little over half, 50 to 60% of news stories about mental illness focused on violence. And so this is a long-standing, sort of pervasive trend where most of the information that the American public is getting from the news media about mental illness has a violence tie-in. Right, and so this is from that same study. It's a very busy graph, but the take-home point is that we saw a suggestion, it's not perfect, and that the sort of volume of news stories jumps around a lot, but we saw a suggestion of spikes of news media coverage about interpersonal violence and mental illness around, not surprisingly, major mass shooting events. Right. So in a separate study, we did a deeper dive into this idea of how is the news media covering mental illness and gun violence specifically. So the last study, the sample frame, was news stories about mental illness. In this study, the sample frame had to be about mental illness and gun violence. It had to be about both, right? So we were trying to zero in on what's going on when the news media is talking about both of these topics in the same news story. We used a very similar sample frame to what I just described, so I'm not going to bore you with the details again. In this study, we looked at news coverage from 1997 to 2012. And what you see here is that half, a little over half, of news coverage occurred in 3 years of this sample, 2007, 2011, and 2012. And that is when 4 of the major mass shootings of this period happened: Virginia Tech, Tucson, Aurora, and Newtown. We did a deeper dive into this data and found that not only was most of the news coverage about mental illness and gun violence over this whole 15-year period concentrated in the years where those events occurred, a lot of it was concentrated in sort of the 2-week periods when those events occurred. So about 35% of coverage about mental illness and violence occurred in the 2-week periods after a mass shooting event. So what that tells us is that the public is getting information from the news media about mental illness and violence, A, predominantly in the context of mass shootings, and B, for a short period of time around those mass shootings, and not as much in other periods, which has some implications that I'll talk about for attitudes and how the public thinks about these issues. So what else did news stories about mental illness and violence include in terms of content? So 8% of all the news stories in our sample mentioned the fact that most people with mental illness are not violent toward others. About 7% mentioned the problem of mental illness being very stigmatized, the adverse consequences of stigma, how it might make people reluctant to seek help. 3% mentioned that it's really challenging to predict the risk of future violence accurately. And only 1% said that stigma, might make treatment seeking problematic, which in the mental health community is a very big concern. Psychosis was the most frequently mentioned sort of diagnostic category as associated with violence, followed by schizophrenia, and you can see the others there. I think that that's not surprising, and actually is sort of proportionately relatively in line with the research evidence, although if we were really going to be in line with the research evidence, bipolar disorder should be up a little higher probably, and personality disorder is like this huge bucket of things that has a lot of variation, and so it doesn't make a lot of sense all by itself. So, I talked a lot about the importance, and as did Dr. Mulvey, of all of these other risk factors for interpersonal violence beyond mental illness, or sometimes in addition to mental illness. They're not coming up very frequently in news stories about mental illness and violence. So substance misuse was the most frequently mentioned, but only in 11% of news stories. Things like unemployment or history of abuse or trauma mentioned far less. I was a little surprised, honestly, that bullying didn't come up more frequently. I would have hypothesized that we would see that more, but perhaps it was a sample frame issue, and because we weren't looking at school shootings in particular, we sort of missed that trend. Right. So I'm a policy person, so I am always really interested in what solutions, what policy proposals are being covered in the news media. And so in this study, we were particularly interested in two categories of solutions around mental illness and gun violence: gun policy proposals and sort of mental health policy proposals. And so gun policy proposals were more likely to be mentioned in this sample of news stories, and the most common gun policy proposal was mental health gun restrictions, right? So which could be a range of things. There were policy proposals, for example, after Newtown introduced in multiple state legislatures, like anyone ever diagnosed with schizophrenia should not be allowed to purchase or possess a firearm, which, of course, as you heard, is very problematic from a legal standpoint because the Supreme Court has determined the Second Amendment grants individual rights for firearm ownership, so that's taking away a right. And then in the mental health policy proposal bucket, about 8% of stories mention sort of general policies to improve the mental health treatment system, policies to allocate more funding, policies to put more standards and quality benchmarks in, those kinds of policies. So just in summary, sort of what we know from these studies, the public is largely exposed to the issue of mental illness and violence in the context of mass shootings. News media coverage of mental illness and gun violence predominantly focused on describing the violent act as opposed to talking about solutions or providing broader contextual information. News media coverage of mental illness and gun violence rarely provided sort of corrective information about most people with mental illness are not violent. And news stories often frame serious mental illness in particular as an important cause of gun violence generally, right? This issue is being focused on in the context of mass shootings, but we looked at specifically when there was a causal frame in the news story about mental illness being a cause of gun violence, whether they were talking about it from mass shootings specifically or gun violence generally. And it was almost always gun violence generally. All right. So that's what we know in a big picture way about sort of trends in news media coverage of mental illness and violence in the US. So what do we know about how that news coverage influences public attitudes? So we have at this point, I think, really a strong body of evidence demonstrating that news stories linking mental illness with interpersonal violence, particularly very serious acts of violence like mass shootings, increase the public's stigmatizing attitudes toward people with mental illness generally. And so I'm going to talk about, just very briefly, one study that we did. I'm actually going to go back. So just to give you, again, a high-level idea of what we're doing here in terms of research methods. So in order to test experimentally how a news story might affect public attitudes, the ideal way to do it is a randomized experiment, right? You randomize some people to read the news story and some people not to read the news story, and then you ask them both the same set of questions and you compare. So historically, a lot of these experiments have been done, as one might expect, like in psychology departments with the Psychology 101 undergraduate students, which is, conceptually great. But Psychology 101 undergraduate students don't generalize to the US population in terms of their attitudes, so limited in terms of how useful that is for policy questions in particular. So relatively recently, within the last decade or so, we've had a great solution to this problem, which is the advent of nationally representative online survey panels. So when I do this work, I use a nationally representative online panel like GFK or AmeriSpeaks, which have like 60,000 people in them, and they can draw a nationally representative sample out of that for me, and I can randomly assign one group to read a news story, one group to be a control group, and then have them both answer the same questions. I can also randomly assign them both to watch a video or to listen to an audio clip, right? It's a neat tool. So that's how we're doing these experiments, okay? So in this particular experiment, we randomized people to a control group or to read a very brief news story. I'm putting that in quotes because we based it on real news stories and content analyses, but we wanted to sort of tightly control some of the moving pieces of it. And so it is a Beth's research team created news story as opposed to a news media created news story. So I'll let you read it briefly. So we tried to make this very parallel to sort of the who, what, when, where elements of the many news stories that we saw about mass shootings in our content analysis. We tried specifically not to make it too sensationalized, which we recognized would sort of bias our results to the null, potentially. But we're interested really in understanding, we flag for a couple times in here that there's likely serious mental illness involved, whatever that may mean to the reader. And so that was really our exposure of interest. So after reading that, people answered a series of questions, 3 of which I'll show here, and we compared attitudes among people who read that news story to attitudes among people who did not read any news story. They just answered questions. And so 3 measures that we used of stigma were 2 social distance measures and a perceived dangerous measure. And so what you can see from this graph is that the dark bar, that's the control arm, they didn't read a news story. Compared to them, those who read the news story in the bright blue reported significantly higher stigmatizing attitudes to the degree of like 10 percentage points or more. And so that single news story, a single exposure, a single point in time, which of course does not mimic how we actually consume news, right? People aren't thinking about one particular news story and answering questions, so there are some external generalizability issues with this. But that one single news story had the power to move attitudes pretty far on the needle in terms of increasing stigma. Okay, so, and as I said, I gave you an example from my work, but that idea of news stories linking mental illness and violence increasing stigma has been demonstrated by others, including Patrick Corrigan's group. And so I feel like that is a very sort of solid finding in the research literature. So the last thing I'm going to talk about is what do we know about how those same types of news stories affect support for policy? And here we know less. So I'm going to tell you a little bit that we know, but I think that there's more to learn here. So in the same study that I just alluded to, where I showed you some results and the news story, we also found that relative to the control arm, people who read that news story you just saw were more likely to support two types of firearm policies. They were more likely to support mental illness gun restrictions, and they were more likely to support an assault weapons ban. We chose those two because it was 2012, and those were sort of the two things being debated post-Newtown most frequently at that point. We could have chosen a lot more policies. Right. We also did a recent experiment using very similar methods, so I'm not going to re-explain them, to understand what effect does news media coverage of mental illness and violence have on the public's willingness to invest in the mental health services system. So a big debate in the mental health advocacy world for a long time has been, well, we know that these messages linking mental illness and violence are stigmatizing, but might they be the best way to get the public and policymakers to be willing to put some more money into public mental health? And so maybe we can take that stigmatizing consequence, right? Take the good with the bad. And so this has been a debate where you have the Treatment Advocacy Center on one side, who's very much adopted that approach, and Bazelon and Mental Health America on the other side saying, no, this is terrible, these messages are stigmatizing, we should never use them under any circumstances. But it hadn't actually been tested empirically. So we did a very similar experiment where we tested actually 3 different news stories. One was essentially identical to what you just saw. We carried it over from the other experiment. There were some nuances that I won't go into, but essentially identical. And then we also tested a news story emphasizing sort of successful treatment and recovery, and another news story that talked about barriers to treatment. Again, these were news stories in that they were researcher-created news stories based on real news stories, but controlled a little tighter. So I'm going to focus here, but I'll just allude to the other results really quickly. So what we found is that comparable to the prior literature, right, totally consistently, of those 3 news stories, the one about mental illness and violence, the mass shooting, that was the only one that increased stigma compared to the control arm. Not surprisingly, a news story about successful treatment and recovery or about provider shortages in the city, those did not increase stigma. Now, in terms of the public's willingness to pay taxes, and we specifically asked, would you be willing to pay an additional $50 in taxes per year to improve the mental health services system? That's what we were asking. That violence news story, what I'm calling a narrative, did increase the public's willingness to pay taxes compared to the control arm pretty significantly. 42% of the control arm participants said yes, they would pay more taxes. 55% of people who read that violence narrative said yes. But you see the stars that indicate statistical significance. The barriers to treatment narrative, which I didn't show you, I'm happy to pull it up on my laptop if any of you are curious during lunch or whatever. That one also significantly increased public support, public willingness to pay taxes. And when we tested the difference between the effects of the violence narrative and the barriers to treatment narrative, there was no difference, which suggested that you could use the barriers to treatment narrative, which is not stigmatizing, and have sort of the same beneficial effects on willingness to pay taxes. So I will conclude, as I said, literally with a question mark. So often, the sort of question that comes out of this, I talk to reporters about my work a lot, and their question is well, how do we fix this? And I'm sort of ooh, you tell me. So just a couple of thoughts, and then I will open it up to questions. So one is this idea of corrective factual information, right? So you saw me show that in news stories about mental illness and violence, a very small proportion sort of brought it out to the big picture and said, actually, the evidence shows that most people with mental illness are never violent toward others. And that seems like a very logical, sort of concrete recommendation to put in these stories. The regrettable reality is that the communications literature around the concept of exemplification pretty clearly shows that that will not do much of anything in terms of changing public attitudes. The idea is that the single powerful example of a mass shooter with schizophrenia is going to totally outweigh paragraphs of corrective factual information. Right? I think avoiding speculation is another one that I get asked about a lot. So in some mass shootings, we have had, documented cases of serious mental illness, and, 2 that I can think of, schizophrenia was diagnosed after the shooting. In others, there is no documented serious mental illness at play. The Newtown shooter is a good example of this. There was some documentation of a developmental disability in his childhood, which is in no way associated with interpersonal violence. And we certainly can't rule out that he was experiencing perhaps a first episode of psychosis, but there was no documentation of that. But a lot of speculation about it in the news media. And the communications research shows that, speculating about, oh, he must have had schizophrenia versus he actually had schizophrenia, speculating versus documenting is a distinction largely lost in terms of the public psyche, right? They saw schizophrenia and mass shooting, and that's sort of what sticks. And so then our research suggests that one way to sort of shift the problematic consequences of coverage of mental illness and violence is to shift coverage of mental illness broadly towards other topics, right? We need to be covering treatment. We need to be covering examples of recovery. We need to be covering the problems with the mental health system, those structural barriers to treatment. Those things can have positive effects on attitudes about people with mental illness as well as support for policy. But at the same time, and while I think that is a concrete recommendation, I also don't think it's at all reasonable to expect that we sort of stop covering mental illness and violence entirely. It's a phenomenon that happens in the world, and I don't think it's reasonable to sort of think that it would never get covered. So I'm very much looking forward to this afternoon and what my media colleagues think about these topics, and I'm happy to take questions from the group. Thank you.
Thank you for a wonderful presentation. All right. Are people with mental illness maligned as perpetrators of violence as an argument against gun control?
Yes, the short answer is yes. So this is a message that is very much disseminated by the NRA for political reasons, right? And other gun control groups, not gun control groups, gun rights groups. In a, take the focus away from the guns way. It's the mental illness, it's not the guns. You should not be thinking about regulating firearms as a policy response. It's all about those crazy people. Yeah.
What role do you see racial disparities playing in media representation of gun violence and mental illness in Black urban communities? And what does media representation or underreporting of gun violence in, so just talking about some of the disparities of how these issues get covered.
Yeah, so this is a great question, and it's actually an area where I've been talking with my colleagues at the Center for Gun Policy and Research at Johns Hopkins about we really need some updated work in this area. We don't have, at least to my knowledge, somebody in the audience, correct me if I'm wrong, we don't have an updated sort of large-scale news media content analysis with the messages that I was describing, characterizing how gun violence in general is covered, and particularly how the racial issues within gun violence are covered. So I would hypothesize in many cases, sort of based on my view of what I see in the news media, that there are definitely disparities in terms of coverage, more focus when the victims are white as opposed to people of color. But that has not been concretely documented, and I think it would be really helpful if we could concretely document it and characterize sort of what exactly is going on in terms of news media coverage. We've had similar studies that are very powerful. For example, the one that comes to mind is by Marty Gillens, and it's on childhood poverty from back in the 90s. He did this kind of national news media content analysis to see how the news media was covering poverty. And the news media was covering poverty almost exclusively as an African American issue. When, proportionally, there were more African Americans living in poverty. But in the US, there are a lot more white people than there are African Americans. There are way more Caucasian people who were living in poverty at the time, and it was totally skewing that, and totally skewing how the public sort of thought about the problem, and of course had implications for policy solutions because, oh, that's not affecting me, that's affecting people of color, so I don't care about doing policies that will benefit them. And so I think there's some definite parallels in the gun violence world, but that we need more work in that area.
Regarding media coverage of mental illness, were your articles about mental illness per se or news reporting of violence events in mental illness? I'm sorry, I'm not sure who asked the question. If you could clarify this a little bit, I'm not sure I follow it.
I might. Let me take a stab, and if I didn't answer it, tell me. So there were two different news media studies, which I sort of blurred together with not a very clear distinction between the two. The first one was news coverage of mental illness broadly. So any news story about mental illness. It could have been a story about a new treatment. It could have been a story about mental illness and gun violence. Any news story about mental illness. And so that's the study where we found that about 55% of all news stories about mental illness focused on gun violence. The second one, where I talked a lot about the coverage of mass shootings, that one only included news stories specifically about mental illness and violence. Tell me if that didn't answer the question, whoever asked it.
I have a question, if I may.
Please.
Policymakers and elected officials following the news is not a new thing, although live tweeting during the broadcast may be a new thing. Could you share some of your thoughts about some of the ramifications and perhaps opportunities of the disconnect between media coverage around the intersection of violence and mental illness and the realities, and how that might impact or provide opportunities for better public policy?
Yeah, this is a really good question, and it's one that I think a lot about, as well as sort of parallel to that, like the role of social media in all of this, which we as researchers have not done a great job, at least so far, of pinning down. I think that what we have seen so far as the ramifications for public policy is that there is too much focus on policies to improve mental health services as a solution to gun violence, which, as I said, is a conundrum for people like me, because improving mental health services would help a lot of people, but it's not going to solve the gun violence problem, right? So it is a mismatch. But you've seen, and I understand why this happens, particularly at the state level, sort of people being willing to take that gamble and saying, like, yes, state legislature, like, pass this bill in response to a mass shooting in my state that allocates, $4 million more per year to my public mental health system. The administrators are like going like this and saying yes, like we'll take it, right? And so that's one area where I think that there is opportunity, actually, although it's opportunity that comes with a cost, in that we have some real examples of this happening, right? Our solution was to allocate more funding towards the mental health system. And so I think that studies coming out showing that while that may have done some good on mental health outcomes, it did not sort of nudge gun violence in the right direction in that state is actually a powerful message in terms of, like, this doesn't work, the solution has not changed, and the public sort of seeing that the problem of gun violence has not changed. It's also, I say, it's like a little bit of a, again, kind of a conundrum in that I don't want that public mental health system administrator to lose her extra $4 million per year because of this. Right? But I do think that that's an opportunity, and I think that we are having enough sort of time and natural experiments for the public to sort of cotton on to that, and like gun violence rates haven't changed despite the fact that you were using a lot more of my tax dollars around mental health services.
Thank you so much.
Thank you.
Yeah.